Hi everyone, I'm Peter Felice. I'm a plastic surgeon at Advanced Cosmetic Surgery in Greenville, South Carolina. And today I'm going to talk with you a little bit about the different types of implants we use in breast augmentation surgery. So patients that are interested in breast augmentation have the option of a silicone or a saline implant for the breast implant itself. The difference really being the material on the inside of the implant. So saline is going to be a sterile saline fluid-filled implant versus a silicone implant is going to be what is a highly cohesive 5th generation, also known as a gummy bear type of silicone filling for the implant itself. Now, regardless of whether it's a silicone or a saline implant, the shell around the material of the implant itself is made out of silicone, and it's going to be designed to give you a little bit of movement, a little bit of flexibility, and a little bit of give for the implant feel itself. So the basic shapes for implants are either anatomic or rounds. The anatomic is also known as a teardrop, which has a smaller diameter, smaller projection at the top of the implant, and then it gets larger as the implant descends. Versus a round implant is going to have a uniform shape, uniform diameter around the entirety of the implant itself. Now, why a plastic surgeon may choose to use one versus another has to deal with the type of texturing on the implant, the type of procedure that he or she is recommending for the patients, and really patient preference based on where the implant's going to be positioned underneath the skin and the tissue and what's going to give them the best desired result that they like. So breast implants are temporary implantable medical devices, meaning we don't expect an implant to stay in a patient for the rest of the life of that patient. Now, there are different reasons why a patient may want or need to have the implant taken out or changed. So for instance, if a patient wants a larger breast size, if they want a smaller breast size, if they have a different breast operation like a lift or reduction, whether or not we do anything or exchange the implant has to do with the patient's goals and desires for that particular procedure. Now, there are other reasons we may choose to take the implant out if it is causing pain or discomfort or has a hard shell or capsular contracture around the implant itself. Those would also be reasons to see your plastic surgeon to talk about having the implant removed. Whether or not you decide to have another implant placed or a different breast surgery altogether, that's something that I like to talk to patients on a case-by-case basis, understanding what the concerns are and what the goals are for the implant during the operation. So thanks so much for watching this little video about breast implants that we use in augmentation surgery. Make sure to subscribe to our channel to see more videos like this in the future. We'll see you there.